Hello, everyone. This is Dr. Sin, your board certified OBGYN national speaker and vulvar skin specialist. I help women to understand and maximize the skincare of the vulva so they are able to understand that this skincare of the vulva, or what I like to call the private face, can be just as beautiful as their public face. So thank you for joining. As you guys join, please like and share as you join. Please like and share as you join. Hello, Nancy. Thanks for joining. As you join, please like and share. We have an interesting topic tonight that I think you guys are going to enjoy. I'm waiting for a few people to come in, and then I'm going to give you your trivia question. I'm also trying to make sure I have everything working over here on my Instagram side. So, hello, Yana. Thanks for joining. As you join, please like and share. Please like and share as you guys join. So, tonight, I'm going to give you all a trivia question. Hold on one second. Let me get my Instagram working correctly here. Oh, I think I messed it up. That's all right. Okay. I don't think it wants to work tonight. How about we just start all over on that? So bear with me one second. I'm trying to multitask. We can add a title later. Let's go live. All right. So as you guys, we're waiting for others to come in. I'm gonna go ahead and give you the trivia question. I finally have my Instagram working correctly. I'll add the title later. So we all know that it's been turbulent times, and that in the last week we've made some profound history in the United States. So the trivia question tonight is, we all know about the Birmingham church bombing in 1963, in which 4 little girls were killed. Can anyone name all 4 little girls in the church bombing? Can anyone do that? Hello, Tiffany. Thanks for joining. As you guys join, please like and share as you join. We want to make sure that women can get all the information that they need. And really the topic for tonight, the men in your family can learn a few things about this one. All right. Please like and share as you join. Trivia question. In September 15th, 1963, the 16th Street Baptist Church bombing in Birmingham, Alabama, 4 little girls were murdered. Can anyone name the 4 little girls? Can anyone name the 4 little girls? Hello over there on Instagram, guys. Thanks for joining. Thanks for joining. Hello, Renee. Thanks for joining. Thanks for joining. Can anyone name the 4 little girls? How about one name? Can anyone start with one name? Tiffany, you're usually a history buff. Do you have a name for the 4 little girls? Hello, Alva. Thanks for joining. So the trivia question tonight, in 1963, the 16th Street church bombing in Birmingham, Alabama, 4 little girls died. Can anyone name the 4 little girls? Hello, Alicia. Thanks for joining. No takers? Let me scroll down. Oh, you are correct, Alethea. Wesley was one of the names. We have 3 more. Any other names anyone can think of? 3 more names. Does anyone have a name? No takers tonight? That's right, Tiffany. Cynthia Wesley. 3 more names. I'll give you one. Carol Robertson. So 2 more names. That's right, Addie Mae Collins. So we have 3 names now. Carol Robertson, Addie Mae Collins, Cynthia Wesley. There's 1 more name. Hello, guys. Thanks for joining on Instagram. Appreciate you guys being here. Yes, Amber, you're right. There was Carol Robertson, Addie Mae Collins, Cynthia Wesley. 1 more name. That is correct, Amber. Carol McNair. Carol McNair. So the 4 little girls that died in the 16th Street Baptist Church bombing in 1963, September 15th to be exact, 1963, was Carol Robertson, Denise McNair, Addie Mae Collins, and Cynthia Wesley. And, you know, when you go to medical school, you always have to write an essay as to why you want to be a doctor, what passions do you have, and hello, Sheila, how are you? And I wrote my essay on Cynthia Wesley and the 16th Street Baptist Church bombings and how amazing the man above can be. So the very thing that the people who caused that bombing thought they were depriving I like to call her the original Cynthia Wesley from being able to do, from all of her dreams that she was not able to accomplish. We move forward to present day, and I've been able to accomplish them, and she looks like me. So I'm happy about that. We now have a vice president-elect who is a woman of color, and that's very encouraging. So for all of you out there in your fields, whatever they may be, when you're stepping out and following your dreams, holding on to your passions, I commend you because you are paving the way for others. So the original Cynthia Wesley, not really sure what her dreams were, but her life was cut short and she was not able to accomplish her dreams. But her life had meaning because really it paved the way for me. So that's how I look at it. Now, enough about me. Let's get into tonight's topic. So once again, I am Dr. Sin, your board certified OBGYN, national speaker and vulvar skin specialist. I help women not just to understand the skincare of the vulva, but to actually optimize the skincare of the vulva, or what I like to call the private face. So they are able to realize that the private face can be and should be just as beautiful as their public face. So tonight, I know I threw a technical term out there, but it's important that you know everything you need to know about the private face. But it's called Pseudofolliculitis Barbe. And some people may say, well, what the heck is that? What is Pseudofolliculitis Barbe? To break things down to layman's term, is when someone has an issue with hair on the body, not on top of their heads, but the beard, private area, where they have razor bumps that are to the extreme. Okay? Has anyone seen a man in their family or a neighbor, especially a man of color, that has a lot of bumps in their beard area? And they could be flesh color, red color, and it's not always the prettiest sight. Have you guys seen that? Well, if you have, 9 times out of 10, it is Pseudofolliculitis Barbe. And Barbie is on the end of the name because it was first described in men and is most commonly talked about with men. But guess what? Their sisters, their mothers, their aunties, their grandmas, their cousins, They can have the same problem that the men have, but on their private face. So imagine that. Imagine that. So that's why we're here to talk about it. So you know what it is. You know if you have it or not. You can learn how to treat it, and most importantly, how to prevent it. Does that sound good? Okay. So I said it's like razor bumps to the 10th extreme. Okay, so that's really the baseline, lamest term definition for pseudofolliculitis Barbe. And basically, what you get is inflammation of the hair follicle without infection. So it's just inflamed. What makes you most prone for it is if your hair is coarse and if your hair is curly. Okay, so this is a condition that is very, very common in African American men and women because of the curvature of their hair follicle. Okay, so men can get it and women can get it as well. So we need to know how to treat it. Now, the bumps can be red, they could be flesh colored. Sometimes they could appear a little bit lighter than the rest of the skin. Complications from having this, you can develop pustules or even abscesses. And we know that's not fun. And hyperpigmentation. Okay. Inflammation, what is that going to do? It's going to stimulate your melanocytes. Melanocytes produce more melanin. More melanin, more pigmentation. So you get what's called post-inflammatory inflammation, which is like a double whammy. You're already dealing with the bumps, and then you got to deal with the darkness of having the bump. And sometimes that darkness can last for a year or two in extreme cases. But for most people, it's months and months before it starts to go away. So any questions just on what it is? Does anyone have questions about pseudofolliculitis Barbe and what it is? Any questions? All right, so we're going to keep it moving. And let's talk about some of the things that we can do at home in reference to treatment. And then we'll get into prevention. So for treatment, if you start to develop these bumps, and this is something that's common for you, you want to use very warm compresses. So when I say warm compresses, you want to take a wet washcloth. Sometimes you could put that washcloth in a microwave for maybe 15 seconds or so, blow it out. You want to make sure it's not so hot that it'll burn your skin, and set that on an area. Leave it on an area for about 15 minutes. And if you could do that maybe 3 times a day, in a few days, it should come to a head and start to heal itself. Okay, so keep that in mind. Keep that in mind as far as treatment. That's one of the easiest treatment options. You can also use an antiseptic solution. All right, tea tree oil. You know how we use tea tree oil, women, in our hair on top of our heads? You can use tea tree oil on this area. It will help to soothe the itch and the pain that is common with this problem. All right, exfoliation. It's important to continue to exfoliate if you have this issue, okay? Even during the treatment, even while you have something there. You do not want to use a harsh exfoliator, okay? Especially when it comes to the private face. You never want to use anything harsh, but something very mild. When you're having a flare, having this issue, I would recommend using something that is very natural and maybe enzyme based. Okay, you could take natural papayas and mash them up and make it into a paste and set it on there. All right, so that's something to consider. You can use over-the-counter triple antibiotic ointment on them. Okay, just on the bumps area. And this is not something I want you to do just as a daily regimen if you're not having this issue going on, okay, because we just don't want to be killing good bugs. But we know that with this problem, you can develop bacteria from the skin can get into there and cause pustules and abscesses. Okay, so it's good just when you're having this flare, when you're having this problem on the bump itself, that you can use a triple antibiotic ointment. You can try benzoyl peroxide. It's okay to use benzoyl peroxide. If it's super duper itchy, it's okay to use hydrocortisone cream. Not a whole lot, just a little bit. You don't need to use much, but it's okay to use hydrocortisone cream. Now, let's talk about when you need to go see a doctor. Okay. So if you commonly have this problem, maybe some of the people in your family have this problem, and you're able to treat it and keep it under control, you don't necessarily need to see a doctor. But if you're having this flare and it's not going away, it kind of never resolves, you need to see someone. If you're having drainage that is increasing and increasing, more and more pus, okay, and it's draining and coming out, you need to go see a doctor, okay? If the pain is getting worse, it's not just a little mild pain with an itch, but it's really painful, you feel like you need to take ibuprofen, Tylenol, things of that nature, you need to be seen and evaluated. If you get a fever, you definitely need to be seen. Okay? If you are a person with uncontrolled diabetes and this condition is worsening for you, I definitely do not want you to hesitate as far as getting in to see your primary care provider or your gynecologist. Okay? And if you're immunocompromised, maybe you're HIV positive, or maybe you're on some medications, let's say for arthritis or something of that nature, and those medicines weaken your immune system and your condition is worsening, then I definitely want you to go in and to see your doctor or your healthcare provider. Maybe you see a mid-level provider, something of that nature, and that's all okay. But I definitely want you to be seen. Now, some of the things that the provider may do, they may give you a prescription strength antibiotic that's topical. Maybe you just put it right on the bumps itself. Sometimes they have to give you a prescription where there are pills that you take by mouth. For really bad cases, they may even need to be lanced, okay? And none of that is fun. For people who have this condition and it's very chronic and they really suffer from it, it's common for the provider, maybe it's not your primary care doctor, maybe they refer you to a dermatologist, or maybe it's your gynecologist who's really into vulvar skincare. They may prescribe Retin-A for you, or they may tell you to start using an over-the-counter Retin-A product, okay? And then if that doesn't help, they'll give you a prescription. So these are some of the things we can do when it comes to treatment. Does anyone have any questions about treating pseudofolliculitis Barbe? No questions right now? Okay. If you guys have questions, do not hesitate to put them in comments. I'll do my best to look at them, try to get to them. If I do not get to them this evening, I will look tomorrow. I always try to go back and answer everyone's questions. So let's talk about prevention. How do we prevent this? Now, some people will just get it, but some get it soon after shaving. Okay, and it's usually shaving with a manual razor. So throw those manual razors out if you have this condition. I do not want you using a manual razor. So some may say, well, why? Why can't I use a razor? What's wrong with a razor if I'm doing all those other things you told me to do? It's a single blade razor. I make sure that it's sharp. It's clean. I'm not using it at other places. I'm using shave gel. Why can't I use a razor like everyone else? Well, when your skin is coarse and curly and you have this condition that makes you a little bit more prone, okay, there also may be a slight hereditary component to this. Then with shaving, when the blade cuts that hair, it leaves a sharp point, okay? And that tip, when it curls back, it makes it very easy to pierce the skin and go back into the skin. So that's one of the reasons we don't want to shave. Also, shaving, if it's super close to the skin, if you're going over the area multiple times, that causes more irritation to the skin. Okay. And with increased irritation, that's going to make the problem worse, not better. Okay. So just stop shaving. Now, if you still need to just remove your hairs, there are other options. You may consider an electric razor. Some people use clippers. Okay. We've already did a whole talk on electric razors. That works better. I would prefer, if you have this condition, that you do not use an electric razor, but some can. You can use a hair removal cream called a depilatory cream. How hair removal creams work is they break down the keratin. The keratin is the protein in your hair that makes it strong. It dissolves that protein at the base of the hair. Okay, that's what the depilatory creams do. And then when you wipe it away with that warm cloth, it just pulls right out and the hair is gone. Now it grows back pretty quickly, but in general, the hair will go away and there's less trauma to the skin. If you choose to use a hair removal cream, do not put it all over the first time you use it. You only want to sample a small area first. Okay. And when we're talking about the private face, my recommendation is you go to the upper corner of the mons pubis. We know what the mons pubis is, right? So if you're naked and you're standing in front of a full-length mirror, the hair that you can see when you're standing looking in the mirror, that's your mons pubis. So test a small little area. Usually with these creams, you leave them on from anywhere to 5 to 10 minutes. And then you wipe it off and the hair comes right off. Okay. So I definitely want you guys to test the area first to make sure that it's okay with you. You can always do laser hair removal. I love laser hair removal because over time, you're not worried about those hairs growing back. Okay. It takes multiple treatments. Hairs can grow back. They usually grow back more sparse and not as thick. But you keep doing it, you can have pretty much complete hair removal. Okay. And people say, oh, laser hair removal is so expensive. Well, it's not as expensive as it used to be. Most places who offer it also offer their patients payment plans. Okay. Because it's multiple treatments, they run specials certain time of the year. You can also use, if you have an HSA or FSA card through your employer, okay, you can use those for hair removal treatments, especially if it's for a condition like pseudofolliculitis Barbe. So keep all those things in mind, okay? Electrolysis, you can do electrolysis. Now that's way more tedious than just straight laser hair removal. And it definitely takes a long time just for the one treatment, and you have to have multiple treatments. And it can be painful. So it's permanent. The hair is permanently gone, but it's not fun. But if you want to try it, have at it. I would recommend laser hair removal. Each time that you go in, it's a pretty quick process. And granted, you need to go, depending on your hair type and everything, sometimes you got to go 5 or 6 times, but it's over a certain period of time. Okay. There's also a medication out there called Vaniqua. Okay. And commonly it's prescribed to, let's say, women who have issues with hair on their face. Okay. You can ask your doctor to prescribe that medication for you for down there. And what it does, it kind of thins that hair out. Okay. The hair will continue to grow, but it won't grow as quickly, and it grows a lot thinner, and it could decrease the occurrences of this problem for you. Loose clothing, I can't say it enough. If you're wearing skinny jeans with, God forbid, no underwear, or with the G-strings, you're just making your situation worse. So make sure that the private face can breathe. Do not suffocate the private face. At nighttime, try to go to bed with nothing on the private face, okay, so that it can breathe. Of course, we always want to practice great hygiene. Hair softeners are good as well, okay? You see a lot of advertisement for beard oil. Okay, beard oil are basically hair softeners, and I know a lot of you guys hear the term oil, and you're like, "Oh, it's going to be greasy." And I'm putting that down there, but it's a dry oil. It's not a greasy oil, but it softens the hair, and with softening the hair, it's less prone to grow back into the skin or back into the hair follicle. Okay. And you need to keep the skin moisturized. If your skin is dry, this condition is going to be out of control. So make sure that you keep the skin moisturized. Okay, so now I'd like to open it up for any questions. Does anyone have questions in reference to pseudofolliculitis, Barbie, or out of control razor bumps? Any questions out there? Let's see. Are you talking about boils too? Valerie asked. Let's talk about a boil and really what that truly is. Boils are a generic term for the most part. It could be pustules. And yes, so therefore I am kind of talking about that. But boils that get really, really big are a little bit different. Boils that kind of turn into long tracts that almost look like railroad tracks, things of that nature, that's not pseudofolliculitis Barbie. Okay. If every time it happens, it has a very bad odor, all those things, that's not pseudofolliculitis Barbie. That's another condition called hidradenitis suppurativa, but we're going to talk about that, just not tonight. We're going to do a whole talk on that because it is a very serious problem for women and is commonly seen, or most commonly seen, in women of color. Okay. Did I miss any other questions out there? Does anyone have questions? I know that's a big old medical term, but it was important for me to make sure you knew what it was. And I didn't want to say just razor bumps because it's a little different than just a razor bump. These are out of control razor bumps all over the place. Okay, so I'll be talking more and more and more about this. And I think you guys are going to really enjoy it. But once again, I am Dr. Sin, your board certified OBGYN, national speaker, and vulvar skin specialist. I help women to understand and maximize the skincare of the vulva, or what I like to call the private face, so they are able to realize that the private face can and should be just as beautiful as the public face. So join me every Thursday at 7 p.m. on Instagram and on Facebook Live, and we will be discussing the private face. Thanks for joining, and I hope you guys have a wonderful evening. Good night.